Hi there, Dr. Chau here. I'm the Medical Director for CeleVenus Aesthetic Clinic. I've been practicing aesthetic medicine for the past 19 years. Over the years, I've gone through different generations of microneedling radio frequency, RF in short. And I'm currently specializing in 3 different microneedling RF machines in my clinic. Today, I would like to answer some commonly asked questions by my patients. So what exactly is microneedling RF? Microneedling RF can be used to treat a number of conditions. It can help in skin tightening, as well as treat rosacea, melasma, reduce wrinkles, or improve the appearance of acne, any scars, and open pores. It involves the introduction of very fine needles into the skin, usually in the range of 30 to 40 needles at one go, or in what we call one stem. This one stem punches the skin superficially in the depth of between 0.5 to 2 mm. While the needles are in the skin, it delivers RF energy at the tip of the needles. There are 2 mechanisms of actions. Firstly, the ensuing mechanical micro-injuries will cause the skin to release growth factors, evoking a cascade of healing processes. This forces the skin to repair itself, resulting in the production of more collagen and elastin. Secondly, the RF introduced at the tips of the microneedles further enhances all the processes mentioned, and additionally causes coagulation and contraction of the underlying skin tissues. All this will translate down to a tightening of the superficial skin of the patients, improving the appearance of pore size, fine lines, stretch marks, and even scars for a smoother and texturally better skin. Now, you may be wondering if this particular treatment is only for specific skin problems, or is it a one-size-fits-all solution? When addressing different skin problems or depending on what the patients hope to improve upon, I may have to select different types of microneedling RF or use a different setting on the machine. Let me give you an example. For someone who is concerned about depressed scars, I would recommend one with slightly thicker microneedles and to perform the procedures with 2 passes. Usually a superficial first pass with 0.8 mm in depth, followed by a deeper second pass with 2 mm in depth. The power setting for the first pass will be lower than the depth of the second pass. By selecting different thickness of the microneedles, the depth of penetration, the power delivered as well as the number of passes, it can potentially affect the outcome of the treatment for different conditions that we're trying to treat. For individuals with hard-to-treat conditions, such as melasma or rosacea, can RF microneedling really help? Yes, it can. With the introduction of dual-wave RF involving ultra-short pulse and continuous wave technology in certain microneedling RF machines, the treatment dimensions have been extended to being able to also improve on hard-to-treat conditions like pigment including melasma, redness of the skin like rosacea. Melasma and rosacea have always been hard to treat. When sometimes traditional treatments with lasers and peels may fail, I'm pleasantly surprised that dual-wave microneedling RF has succeeded in some of my patients. I must say that it's very useful to have it around as an option to treat melasma and rosacea. At this point, you might also be considering other treatment options. Well, there are other tangible benefits that may come with microneedling RF treatment. For one, it can usually be safely performed on patients with different skin types and skin tones. The risk of complications are usually low compared to other more aggressive forms of treatment. Patients typically experience little to no downtime post-treatment depending on their lifestyles. Post-treatment care is simple and does not require much aftercare. The treatment is mostly comfortable and tolerable by most patients. Last but not least, it's a 12-in-1 treatment that can potentially confer many skin benefits and treat multiple skin conditions. It's very versatile and can potentially yield better treatment outcome versus other similar treatment options.